Vanessa, when you look for a pediatrician to give you advice, I mean, present company excluded, obvi, what do you look for in a person? Like, what are the traits that you are craving that make you think this is someone whose advice I really want to listen to?
I think someone non-alarmist and reassuring and calm, someone who's sensitive to kids' feelings and experiences, someone who does not dismiss my worries or fears as a parent. And yeah, I would say those are my biggies.
Right. So you're pretty much describing Dr. Jessica Hochman, who's here with us today, who's like the calmest, most measured, most thoughtful pediatrician. She happens to be based in Southern California. She's what's called over the hill from me. She's on one side of the hill that divides Los Angeles. I'm on the other. We like to meet in the middle. She's amazing. She's a board certified pediatrician, and her father was a pediatrician. So she followed in his footsteps, but has carved out a really interesting path and practice for herself that includes a really engaged social media feed and podcast by the same name, Ask Dr. Jessica,
which we have been on and we had a lot of fun. So we hope she answers a lot of what seem like basic questions, but come up over and over for people raising tweens and teens. And it's so nice just to get some reassuring guidance and advice about how to manage all of these different things. Enjoy.
Jessica Hochman, we are so thrilled to have you on This Is So Awkward, the podcast. We have had the great fortune of being on your podcast, and I have the even greater fortune of being drivable from where you live. So we have now started to see each other a little bit more out of podcast world, which is a total treat. But just the way you convey information about all sorts of things that are related to the world of general pediatrics and raising kids and communicating with kids, it's such a slam dunk. I don't know why you haven't been here before, but welcome.
Thank you so much. What a wonderful compliment, especially coming from you guys. And I have to tell you, I am equally and if not more excited to be here on your podcast. So thank you so much for having me.
So, okay, here we go. Vanessa, you going first?
Go for it.
I mean, I just want to go. I just want to go.
You want to go?
We made this list, like, listener, just so you know, even though it sounds like we've never organized what we're going to talk about on a podcast, we actually really think about it. And we have a very well thought through structure for each of these conversations. And not going to lie, the conversation structure that pertains to this episode started with a list of about 5 million things that we could ask you related to illness, injury, things kids are afraid of, things kids fight back against, travel, communicating with healthcare provider, communicating with educators. Like, it was all of it. It was the whole universe of stuff we talk about. So, Vanessa, I think we just dive in.
Absolutely. Absolutely. So it's November. We're recording this in November, and we are entering the season of, the cesspool of our homes. Although I feel like my home is sort of always a cesspool, but I guess it gets worse. And I'm in New York, so it gets cold and the winter months and all of that. Jess, what should we be thinking about? What are the sort of common tween and teen illnesses? Some of which we may have never heard of or can't believe are still around. Some of which we thought we were done with when our kids, got into grade school, and yet they're reappearing. I'm talking to you, strep throat, that my college kid just had. So give us the universe of kind of common illnesses and what we should be aware of.
Yeah, so great question. And there are definitely a lot of illnesses that we could talk about, but I can tell you generally, we are approaching our winter season. So there's the typical cold viruses that are out and about. Definitely flu season will be starting soon. Usually flu season kicks into gear, I want to say end of December through February. So if you haven't gotten your flu shot yet, you definitely still have time. The surprising illness that has been more on the rise now than in typical seasons is walking pneumonia. So maybe some of you listeners have heard of the term walking pneumonia. Maybe you've gotten a notice from your school that there's been a kid in the class that's had walking pneumonia, like my daughter got this week. But why it's called walking pneumonia is because you have symptoms that are reminiscent or remind you of pneumonia, but you're not as sick. So you can still walk around with it, even with having a cough and a fever and maybe some congestion, feeling tired. You're still able to get yourself to school, see your friends, which is great. But then also it makes it easier to spread amongst school-age children because these kids are often still going to school.
How is it spread, Jess?
It's spread respiratory. So just that means if you're around another kid and you breathe on them, or you don't have clean hands and you've rubbed your nose that's snotty, and then you touch the hands of your friend and then they rub their nose. So it's contact spread, respiratory spread. What I think is interesting to know about walking pneumonia, it's caused by a bacteria called mycoplasma. So if you think about most viruses, we don't really have a treatment for them. We can't offer an antibiotic because they're caused by viruses, but mycoplasma is a bacteria, so we actually can test for it. So many offices can test for it, doing typically a swab in the nose, and then there's an antibiotic that we can offer. The most common one that we offer is azithromycin, also known as a Z-Pak. Most people have probably heard of a Z-Pak. So I guess what I would like parents to know is if your child has a fever, a cough, they're feeling tired, and they're not getting better, and it's been a few days, I would talk to your pediatrician and see about getting tested for mycoplasma, because maybe there's something that we can offer to get them better.
And let's get into we're in holiday season, right? So let's get into the layer of exposing family members and especially exposing grandparents on a scale of 1 to 10 in terms of mycoplasma risk and exposing the grandparents. So not knowing your kid's kind of coughing, they seem fine. They're walking around, they're playing, they're eating okay. They don't really it's Thanksgiving or it's New Year's or whatnot. When should you be concerned enough to protect the grandparents and other family members?
It's an excellent question. This comes up every year, right? Because we tend to get mostly sick, flu season and whatnot, during the holiday season when we are around our relatives. So to me, the big picture advice is, especially grandparents that are on the more elderly side, more frail, immunocompromised, maybe they have some health complications themselves, I would be extra mindful. Even with things as, minor colds, any sort of sick symptom, I'm all about transparency, being open and honest with what your child's symptoms are. Some grandparents might not be everybody has different tolerances to being around illness. So I just think keep the lines of communication open, and just be mindful of those grandparents that are on the more frail side.
And also just a plug for kids whose parents, the grandparent generation, is really bummed out. They really want to hang out with the kids. They feel like they're missing the thing. And I think it's important for us to acknowledge that the parent generation stuck in between has to manage a little of that. And having those frank conversations with their parents saying, I know you want to be here. I know you want to be hanging out and creating memories. Let's do it a different time in a different way. Because walking pneumonia in particular, the people who walk around with it tend not to be the very old or immunocompromised or otherwise chronically ill.
Does the pneumonia vaccine that a lot of older people get, is that a different bacteria from walking pneumonia?
It's a different bacteria. So that vaccine protects against a bacteria called pneumococcus.
Okay.
And this bacteria tends to be mycoplasma. So great question.
And what about the flu vaccine in terms of we're hearing, people, oh, I got the COVID and the flu, and it was I was out for days, and other people say, oh, no, I'm fine. How do we think about flu and COVID vaccines and flu, and how do we go about our daily lives or not when we're dealing with that stuff?
That's such a great question. So the flu vaccine, while I believe it's worth it because it protects you from getting the flu, and it may make this, if you were to get the flu, it may make the symptoms less intense. So I say it's like it takes the venom from the bite.
Mm-hmm.
And also in kids, we tend, in terms of side effects, children tend to respond with fewer side effects to the flu vaccine than adults. So a lot of adults say, oh, when I get the flu shot, I feel really icky afterwards. Kids, I don't see that so much. They tend to do very well with the flu shot. The problem with the flu shot, in all honesty, is it never works perfectly. So the data that we're getting back from this season shows that we get the data from South America because they get the flu first before us. And in South America, they've shown data that the vaccine is working about 35% at preventing adults from being admitted to the hospital. So last year, the flu shot was about, when you compare, it was about 50% efficacious at preventing hospital admissions. So we'll see what happens. I still think there's value in getting it, but it's not looking this year like the flu shot is as effective as last year. So even more reason just to do what you can and be mindful of those that are more susceptible and vulnerable to the flu illness.
Yeah, because let's do a plug here for a second about flu vaccine. This is really important. Every single person who has any initials at the end of their name that suggests that they work in healthcare gets this conversation. The flu shot made me so sick and it didn't work and I still got the flu. Okay, understood, received and understood. But there are two things that are really important to weigh. The first is if it didn't work because you still tested positive for flu and felt ill with flu, I would suggest, how sick would you have felt if you hadn't had partial immune protection against that same flu virus? Now, some people will say, I have a lifetime of partial immune protection because I've gotten tons of flu shots over the course of my life, or I've gotten the flu several times. And you can hold more than one thing to be true at the same time. So when it comes to flu shot, even if it's not a perfect match, it doesn't mean that it's not retraining your immune system. It's like, I might get on the elliptical. If I want to run a marathon, that's not great training for running marathon, but maybe I could run a couple miles of the marathon and I would feel okay because I've got some good cardiovascular training, right? So like there's the partial match of when Jessica's like, oh my gosh, this is not a way I ever talk about vaccines, but it's important.
I'm thinking about, I've had conversations with you and your husband about how good of runners you are. So, and I've seen your son after he's finished a rowing workout. So I'm picturing this, I'm visualizing this. This is true.
Yes, yes, you like my example. But I think it's really important to say, this is not binary. It's not analog. It's not when it comes to many vaccines, they either work or they don't. The measles, mumps, rubella vaccine, when you get an MMR shot, it either works or it doesn't. And the reason people get more than one dose is to pick up the first group in whom it didn't work. But flu vaccine is a little bit different. It's relying upon the match of the circulating flu. And there's a lot of data out there that some coverage is beneficial. The other big plug I want to make is this has gotten very crowded, this whole vaccine field and the whole vaccine conversation, because in addition to seasonal flu vaccine, which forever has received pushback, now there's also seasonal COVID vaccine, and there are new generations of Pneumovax, the pneumonia vaccine. And if you haven't gotten your shingle shot and you're of a certain age, you're supposed to get that. And suddenly, adults are feeling a little like kids. They're like, wait a minute, I have to get all these vaccines. So, Jessica, do you have a way through this conversation with adults? Because they seem to be making decisions a little differently for themselves than for their kids. Do you have any sort of suggestions of ways to think about it that will help inform people, places they can go to read about this or to learn that are valid resources that you rely upon, like help someone out?
It's a great question. I think the vaccine conversation, I agree, because there's so many different vaccines and they all work differently. I'm always happy to answer questions. I think the stance that I take is I want to make sure that families know they can ask me and it's a non-judgmental space. I talk about vaccines every day at work and I want to hear what their questions are. What are they worrying about? Let's have a conversation. And so I think as a healthcare provider, that's the stance that I take, is just really, I want to know, what are they worrying about? because oftentimes there's solutions that we can offer. So for example, if you're wondering about trends, good resources, the CDC often will talk about trends that are happening, how well vaccines are working. I also find that a lot of people are nervous because they have, adults especially don't like to admit it, but they have vaccine anxiety, not because of the vaccine, but they're just nervous to get a vaccine. It's something like 50% of adolescents are so scared of vaccines because of not because of the after effects, but of just the anxiety of getting a poke. It's enough anxiety that it will change their medical decision making. And adults, it's about 25%. They don't want to admit it, but they're scared of the idea of getting a shot, and that it's enough to change their medical decision making. So I'll refer them to sites like, there's something I really like called the MEG Foundation for Pain. I highly recommend if anyone's listening and they are scared of vaccines. It's an amazing resource, an amazing website where they offer all sorts of tips and tricks to help confront vaccine anxiety. So we'll have conversations like this.
And if people are, have someone in their house who really has a fear of shots, I would say I've been not a deeply sympathetic person to my own children as they were getting shots. I would say I was fairly dismissive of their fears, which they would tell you if they were sitting here. What are your recommendations? I mean, one of my kids, when he got the HPV vaccine, he was like, first I had the pediatrician explain to him why he needed to get it. And it went something like, do you want warts on your penis? And he said, no. And he said, great. So let's do this. And then when he gave him the shot, my son was like, ow. And I was like, this is do what I say, not what I do. I was like, oh God, you're such a wimp. It's not that big a deal. I mean, talk about what a terrible parenting move that was. And then he left the room and the doctor was like, actually, that one really, really stings. And I felt yes, I felt so guilty. So how do we, it's like busy. We're running from basketball practice to doctor's appointment. We're packing, we're dealing with getting dinner we don't have time for dealing with the fear. How do we deal with the fear effectively?
All right. So I've got a number of tricks and suggestions up my sleeve. The first thing I'll say is I like to be honest and transparent with the kids. So a lot of parents, the kids will show up here, the teenagers, they'll show up here and the parents sort of intentionally don't tell them about the vaccines. They just want them to deal with it and not have time to build up anxiety ahead of time. I actually find that works against the situation. I think it fosters a trust if the parents let the kids know ahead of time. The language that parents use around vaccinations make a huge difference. If you stay positive, that makes the biggest difference. The number one reason why kids are anxious about vaccines is having parents that are anxious about vaccines. So obviously that doesn't apply to you, Vanessa. but you can picture it, right? If
what does the research say about having parents who are deeply unsympathetic to your worries about vaccines? Well,
I'm a similar parent to you, I have to admit. So
it's a grit builder.
Hopefully good things.
So we need to manage let's say I was someone who was, anxious about it and being a deeply feeling parent. I need to figure out how to manage my anxiety in front of my kid if they're going to get. Okay.
Yep. Fake it till you make it.
Can I make you feel better for a second?
Yes.
I think I've told you the story, Vanessa, of the patient who required 2 professionals in my office to sit on their extremities so that a third one could administer a vaccine. The part of that story I don't think I've told you is the parent of that child was extraordinarily empathic in the first hour of the visit. And let me tell you, they lost that empathy over the course of the next hour as they were negotiating. So we evolve as right. Our feelings evolve through this process. It's a big deal. This is a massive time suck in a pediatrician's office.
So true. Right. It's so true.
And for good reason. When I was a COVID vaccinator, I was doing all the kids as the COVID vaccines first came out. And this is what parents would say to the kids. Oh, I know it's going to hurt, but you get to get your COVID vaccine. The kids look at the parent like, it's a vaccine. Let's stop it. Shot. There's a needle. So you keep very good company, Vanessa. I think the way you get through it is absolutely A-okay. There's no right way through it as the parent.
No, I mean, there's some tips that I think not everybody may know about. Now there's over-the-counter lidocaine, which wasn't available before.
Oh yeah.
You used to need a prescription. Now you can buy lidocaine 4% over the counter. So sometimes for kids that are anxious about their vaccinations, we'll tell this to the parents ahead of time. They can put the cream on the skin, wrap it in saran wrap. It stays numb for a couple hours so they can come ready to go. That can relieve anxiety.
Just for people who don't know, lidocaine is a cream that's like a numbing cream. So it's like Novocaine, but for the skin. I know these things because I use it before I get lasered.
You know these things because you're also a doctor.
Yes,
also,
honorary.
Just note that you said, Jessica, it relieves anxiety. And I think that's very important. There's probably a significant placebo effect to this. The skin itself is numb, but what actually hurts from the shot is not the puncturing of the skin as much as the fluid going in and
yes.
et cetera. Yeah.
Yes. To your point too, Cara, I think the language that parents use, it may or may not help, but I do find that if the language that I tell parents or encourage them to use is to not say, you have to get a shot. Because a lot of parents will say, you have to get this to go to school. I think it's more useful and helpful if you say, guess what? We are so lucky. You are so lucky that you get a poke, and this poke is going to keep you from getting, cervical cancer, pneumonia, ear infections, you name it. You go down the list of whatever vaccine they're getting. And if you make it more of you're lucky, this is a magic shot. This is amazing, because it is. So if you frame it that way, that can often help as well. Also, I think sometimes you just got to get it done. You just maybe make the first appointment in the morning,
just
get it done quickly.
I often don't know if my kids, if it's like time for them to get a shot until we're sitting there and they're like, oh, guess what? And I'm like, lucky you. And there's all sorts of techniques. We could do a whole episode, Jessica and Cara, on techniques to like manage, to sort of not trick kids, but to manage all of that, which I find so brilliant. I'm going to take this question because I had a broken nose in my I have broken my nose, but I got a FaceTime from a college kid who was like, don't worry, I wasn't in a fight. And I looked at him and I said, your nose is broken. And this literally on FaceTime. And he was like, what are you talking about? It's fine. And I said, take a screenshot of this FaceTime and look at the picture. And he goes, oh, dude, it is broken. So let's talk about broken noses, broken fingers. What do we need to be thinking about? When are we rushing to an ER doctor? When are we just kind of managing stuff? Like, what do you see most often coming through your doors?
Okay, so the breaks, I have to admit, they sometimes come through my doors, but usually the parents that I deal with go right to the orthopedic doctor. But yes, breaks are fairly common with kids. I will say the good news with children is that sometimes the breaks heal faster than sprains, believe it or not. So if things look disfigured, so for a nose break, for example, if the nose looks displaced, if you see fluid coming from the nose that you wouldn't expect, but really looking displaced or out of line. So noses often get hit and they feel swollen, they feel tender, but the nose itself should look more or less like the nose you typically see. But if it actually looks displaced, that's when you want to go to a orthopedic doctor or seek higher level of care than your pediatrician. And the same would be fingers if it looks displaced or angulated. So usually visually you can tell a displaced fracture. Sometimes we'll have hairline fractures or minor fractures that aren't that obvious that you would need to see on an x-ray, but most bad fractures that need to be seen immediately by an orthopedic surgeon, you can just see that the alignment of the finger or body part looks off. One trick is to compare the right and left side of the body. So if you look, oftentimes I'll look at an ankle of the left side, compare it to the right side, and that can give you some good information.
And how about purple discoloration? Sometimes I used to use that as my cue, although it can be what we call a hematoma, right? It can just be blood.
Yeah, I think I've seen purple from bad sprains. Yes, from a fracture. It would probably be a soft sign, blood just showing blood. It's a sign that blood is coming to that area of injury.
I like how I asked that question innocently, but really the story is that my son, when he was 2, he fell off the bed, but I was at work. And so I came home that night and the person who was staying with him said, I think he's fine. And, he fell off the bed and I he was asleep and I examined him and I was like, he's fine. And the next day I checked him and he's fine. And then 10 days later, a black line appeared at his wrist. And I called the orthopedic surgeon and I said, did I miss his fracture? And he said, you sure did.
Oh, God.
And I said, do I need to come in for an x-ray? He goes, only if you want to feel bad about yourself. And so I always like file away that black sort of, if there's a deep discoloration, just pick up the phone and call someone.
And the other thing for parents to know, oftentimes it's not an emergency. A lot of things won't change that night. If you want to go to the ER that night, okay. But it's persistent pain. It's if the child sleeps on it and their wrist or their ankle or their body part is still bothering them, it's really tender to the touch. Those are also clues to see a doctor right away.
Right. I mean, there may have been moments in my house where a kid was complaining and I'm like, oh, you're fine. And then a few days later, they're really not fine. And it turns out there was like a broken wrist. One of the biggest winners was when my husband spent 5 hours in the ER with my kid getting a cast on his wrist. And then later that night, he walked out of his room with the cast in one hand and the supposedly cast arm in the other hand. And I was like, I've never been so angry at a kid in my life. And
how did he do it?
Well, so then we went back to go see the orthopedist, like not the ER doctor, but the orthopedist. And he was like, oh, he should never be able to pull off that cast. It was the person who put the cast on fault. And I was like, you are not helping me out here. This is not a useful analysis of what happened. This episode should be called All the Ways in Which Vanessa Failed Her Children in Medical Settings. So to that point, let's talk about deep cuts.
Yes. Oh, and by the way, just something I want to just say for parents listening, we're not supposed to prevent all of their injuries or their accidents. If a kid never has a broken anything or a cut or a sprain, that means they're probably inside too much, watching video games, on the TV, on their screen. So I don't want parents to feel like their kids should never have injuries. I mean, these conversations are good because prevention is always helpful and to know what to do and what to look for. But kids are honestly, they get better. So if your child does have an accident, it doesn't mean you're a bad parent. And if you wait on it for a few hours to see how things evolve, that's okay too.
No, you're only a bad parent if you respond the way I responded. So let's talk about cuts, deep cuts.
I'm going to have to stand up for you, my friend Vanessa.
Well, I should actually have my kids on here, all of our kids on here, and they can talk crap about all the ways we mishandled stuff.
I'll tell you too, my dad's a pediatrician. So I grew up with a dad as a pediatrician. He was so dismissive of all of my aches and pains. I mean, it was almost comical. You'd sprain your ankle. No, but can you walk on it? All right. And then that was the end of the conversation.
Exactly.
Yeah. Cobbler's children.
Yes.
How do we know if a cut requires stitches?
Great question. So most cuts that kids have, they're tiny abrasions. You can just clean them with water and soap and they're okay. Stitches are, maybe some people can picture it, but they're more of a gaping wound. So you might see some subcutaneous fat. You might see muscle even. If the cut looks jagged or deep, I would get it evaluated. If you have a cut from a dog bite, that's also something that I would always show a doctor because sometimes that necessitates plastic surgery, especially if it's on the face or an antibiotic. But yeah, it's the depth of the wound. I would call it a gaping wound, often needs stitches.
I just want to go to dog bite for a sec. I want to go deeper there.
Yes.
So big PSA here. Number one, if you don't go see your doctor, please call a doctor if there's a dog bite, because if the skin is broken, by and large, that bite should probably be treated with antibiotics, at the very least, really thoroughly cleaned. In medical settings, the biggest deal about managing lacerations, deep cuts, is the cleaning of them. It's getting whatever could potentially have dived underneath the skin surface and into either the subcutaneous tissue or get into the bloodstream. That's your issue. And you think it's hard to give a kid a vaccine? Try deep cleaning an open wound, which if you're listening to this podcast, chances are you have deep cleaned someone's wound and it's very painful, right? Whether it's road rash and that kind of scrape or it's a cut. So when in doubt, especially with the dog bite, call someone. But also, if you can't clean it effectively or you're not sure, to me, Jessica, that is a reason to kind of get off the fence and just go in.
Absolutely. When in doubt, definitely just get off the fence and come in. I agree. And I think the other thing to keep in mind is the most important thing you can do is clean it well. And so some people wonder if they need hydrogen peroxide or betadine or special soap. The most important thing, if there's a wound that might be dirty, is to use water and gentle soap. And that I can't stress enough. So just if your kids ever scrape their knees, it looks dirty, just make sure you clean it really well with soap and water.
Although if your kids are anything like my kids, hydrogen peroxide is the best party trick because it becomes mesmerizing to watch those tiny little bubbles form. And there are some kids who they're literally distracted by the cleaning process. So it's a really good way. Once you do the deep cleaning that you just described, you can always play the hydrogen peroxide game and do a little soak. And it like these bubbles go crazy at the site of the cut or the abrasion. It's amazing.
And who doesn't like a good party trick?
I mean, come on. Yeah, seriously.
But if your kid gets the cut when they're not with you, which happens more and more as they're independent, they might have gotten themselves a Band-Aid, but they might not have actually cleaned the cut or the wound. And so asking
for a friend,
did you wash it with soap? Often the answer is no, I didn't. Like they're so proud of themselves that they put the Band-Aid on and you're like, yay, bravo. But making sure they actually wash it. And if they didn't, maybe even with older kids, like being there when they wash it, because soap is a challenge, apparently. Related to that, Jessica, I want to talk about how we teach kids independence with their own self-care, their own medical care. When are the right times and the right stages for them take medication on their own, to take care of, bumps and bruises and all of that stuff? How do you kind of on-ramp kids through that process?
I mean, I think it's age dependent and it's child dependent, but I think whenever you can encourage them to take a step towards their own autonomy when it comes to their own health, I think that's a good idea. So I'm trying to think of a specific example, but yeah, I mean, you can encourage your kids, take a shower every day. Here's your medication. I'm going to leave it. I mean, I'd probably just have an honest conversation with them. And I think most kids, when they can be independent, they want to be independent.
So if there's, for example, a kid who's got a headache and they're, 11, do you send them to the medicine cabinet on their own? And to how do you on-ramp sort of like taking ibuprofen? What if they only take liquid and are having trouble swallowing pills? And then you basically are buying like an entire bottle of baby ibuprofen each time they need it. Like what's the process for moving them towards independence if they're not kind of naturally capable or don't have the executive functioning for that?
It's a good question. I think I would first show them, right? So show them what the dose is. And then I would probably watch them next. Okay, you have a headache now. Let me see if you can do it on your own. And once you've gained confidence that they are taking the proper dose, then you can allow them to do it on their own. In terms of liquid to pill, that is a common issue with kids because a lot of times I think parents, honestly, we don't give kids the opportunity to start swallowing pills. So I also think the onus should fall on us parents to encourage them to be more independent. So whenever they're taking a liquid, hey, do you want to try a pill this time? And there's ways to practice to get better at it. I mean, people will try swallowing Tic Tacs. They'll try swallowing mini M&Ms.
Smart.
Yeah.
We were going somewhere where we needed to take like certain pills and they could only come in pill form. Like we needed some vaccinations or I think it was malaria or something. And my younger kids had never taken pills and they came up with all these crazy methods to take them. And there were like pills like flying across the kitchen because they were like trying all these strategies and they were just like projectile shoot. And they got there, but now they have really weird ways for taking pills because like they've stuck to that one strategy. But I like that. Tic Tacs, mini M&Ms, and edamame. Something small.
Jessica, one of the more common questions that doctors in general get, but pediatricians especially get, has to do with finding the right provider for a kid. So there are a few subdivisions of this question, and we want answers to all of them. So one set of questions has to do with referrals and finding the right non-generalist, but someone to manage a specific problem. That's one group. But I want to start with the other half of the question, which is when you are or are not the right doctor for a kid. And here's what I mean by that. How many times have you had a parent of a tween or teen boy ask you, should he be seeing a female doctor or should we be switching doctors to match up the gender and help me understand what the right thing to do is here? And likewise, male pediatricians get this all the time about females. So can we start there with like, what's your recommendation through that question?
So my personal approach is I want to make sure parents know that I'm just happy that they're getting medical care. And if they're comfortable with me, fantastic. But if at some point they feel like they'd rather switch, for example, to a male provider, they're a teenage boy, I never mind. I understand. I'm just happy that they're getting their needs met because I think it's really important to feel comfortable. If someone doesn't feel comfortable going to the doctor, guess what? They're just not going to come. So right. I definitely think as doctors, it's good to remind ourselves to not take these things personal.
And it's also a highly female field at this point in pediatrics. So oftentimes, there is not a male alternative available, right? So this question is changing over time, which is kind of interesting.
Yes, I know. 50 years ago, it was all men. So it's definitely flipped. But I agree with you. I think just being honest, and I'll always ask the patients, are you comfortable if I do this? Are you comfortable if I do that? Especially if I'm examining them, that's a little in an area that's a little more private, and just make sure I get their full consent, obviously.
One of the most common questions we get, because we talk about puberty all the time, are the questions of early bloomers and late bloomers and when to go see a specialist. How do you handle that? What are the things that you like to address in your office, and what are the times when you're going to send folks to a specialist?
That's a great question, because a lot of the times, honestly, I can handle it on my own without referring to a specialist. The two big things that I look for is the interval growth. And then oftentimes we'll do a bone age. So a bone age is when you do an x-ray of the left wrist and you can see, are they truly going into puberty early or is this normal? Believe it or not, a lot of times it's normal. As you guys know, puberty starts pretty early now. So oftentimes when we see kids on the younger side, it's surprising to the parents, but it doesn't necessitate seeing a specialist. If the parents want to see a specialist, I'm always happy to give them names and referrals. But a lot of times it just takes reassurance on our end that their child's normal.
Here's my PSA to the parents and caretakers who want to self-refer themselves and they just want to bypass the pediatrician and go to the specialist. Please loop in your general pediatrician, because they are really great communicators and they will help bridge that for you. It is the rare general pediatrician who will literally physically stop you from going to see the specialist. Most people are like Jessica. They recognize that if the need and desire is there, great, let me help you, let me facilitate it. But those specialists, they need your medical records. They need your growth charts. They need to know what your history is. So it doesn't really help you to try to bypass them. And in fact, it ends up creating, I think, a little communication hiccup that does not need to be there. Would you agree, Jessica?
Yeah, absolutely. And oftentimes we're also easier to get in to see faster. And I know what the specialists are going to look for. There's certain labs that they want. They're going to want to see a bone age. They're going to want to see the growth chart. So I can get that started so that if they do, in fact, see a specialist, it'll save them time in the long run if we get all of that ahead of time.
And is that true of the late bloomers too? That you do the same analysis, the same scans? I think the anxiety, there's so much anxiety for the parents on both sides of that, both for the early bloomers and the late bloomers, that I would imagine that you feel a tremendous amount of pressure from the parents to kind of do as much as you possibly can.
Yes. And I think if you can really reassure them that their child's doing great. So, for example, a late bloomer, about 50% of the time, usually there's a parent that was also a late bloomer. So if you can explain it, look, remember this happened to you. You went through puberty from this age to that age, and you can show that it's the same thing is happening to their child. Oftentimes we can reassure them in a way that parents leave feeling comfortable.
And there's a list of other specialties that we refer to all the time as pediatricians, right? Other than endocrinologists, hormone doctors. And I think it just bears saying some of them that are really common so that if there's a listener who's thinking, I've been thinking about asking for a referral and maybe I should talk to my pediatrician. So therapists and mental health care providers are like top of that list, I would say. And there are a whole host of them that have a big variety of backgrounds in terms of their training. Cannot emphasize enough that your local pediatrician will generally know the people in your community who have the best resources and who have managed very similar situations. That's a wonderful, wonderful place to be in conversation with your primary care provider about who that mental health care provider might be, and talk about impossible to get into, right, Jessica?
Absolutely. No, definitely. I mean, I have an obvious bias, but always start with your pediatrician, especially if you have a good relationship with them, you trust them. I also tell you a personal story. My son, so I'm pretty tall. My husband's tall. I'm 5'8". My husband's 6'1". My son, at the age of about 15 months, he was 12th percentile for height. And so even though I'm a pediatrician, I did go see a specialist because I didn't want to be worrying about him without getting input from a specialist. And it turns out he's that late bloomer. My mom was a late bloomer. My sister was a late bloomer. Now he's 11 and 50th percentile. Yeah, so I relate to parents. It is stressful when your child is a late bloomer. And the hard thing about growth is that it takes time. It takes time to have those results be apparent because, a child usually grows 2.5 inches a year. So I think my role as a pediatrician is I do what I can to make sure and ensure that the child isn't having any issue apart from it being normal growth. And then then reassuring the families.
Let's close with some travel advice because people are going to have questions about, can I get on a plane with an ear infection, or my kid has surgery? Like, how quickly can they travel again? Or, wisdom teeth, all of that. Car's raising her hand.
Because I have a story.
This is a real show and tell episode, Jessica.
This is.
I like it.
One of us might have had a child who started throwing up about 8 hours before a flight home.
No.
And it was the last flight out that night. And there were no flights the next day. And we were not getting home for another 2 days if we didn't get on the plane. It was a conundrum. You want to know what I did?
What'd you do?
Okay. So, we assessed the situation. Let's start with that. So she had eaten something that didn't agree with her. And that was very clear from the history of it. It wasn't, I was not worried about her giving a stomach virus to another person. But what I did is I treated her. I actually gave her Benadryl for the nausea, because Benadryl works really well for nausea. And she was an older, mid-teen at this point, and it was enough to also make her a little sleepy, which reduced her anxiety a little bit, interestingly, about getting on a plane. And we got on the plane, and it reduced her nausea enough that we were able to make the 5-hour flight. She made it through. We ran off the plane at the other end. I will say, I do believe one of the contributing factors to the success of this approach was that when we were in the airport, waiting at the departure gate before we flew home, she saw someone she knew. And there was no way she was getting sick on a flight with someone she knew.
Wait, that's so crazy, because the same thing happened to me. One of my kids, yes, had food poisoning, and he was like throwing up all night. And I was like, I got to get this kid home. But he knew there was going to be someone we knew on the flight. So he basically did not eat or drink anything for like the several hours leading up to it. So he wouldn't throw up in front of this person on the plane.
I am convinced that is why. And she still talks about it to this day. She was like, that is really what made me not nauseous. Yeah.
He was then like completely dehydrated when we got off the plane. Someone's going to be calling Child Protective Services.
So Jessica, other than when, I mean, and this is actually really important because we do have a social responsibility not to get other people sick on a plane. So that's really, really important. But like, what are your recommendations for you got to get home and you're just not sure what's going on and what to do?
Yes. So when someone is vomiting, the big concern from a medical perspective is typically dehydration. So that being said, I would forget about food. I would forget about food. If I were to go on a flight, I would really try just to stick with sips of liquid, maybe Pedialyte or another electrolyte drink. But I would eat lightly, or if you can help it, not at all. Because what happens with an irritable stomach, if you've been throwing up, if you eat a little food, you are increasing that risk of throwing up again. I'd also probably bring a lot, like a change of clothes, some extra cleaning wipes, just in case you do throw up. This was
a barf bag, which they used to have at every seat.
Yes, they don't anymore. Huh?
No, go old school.
And then if you can, Zofran can be helpful. Zofran's an anti-nausea medication that can be really effective if someone's been throwing up.
I always love pediatricians. I know, but pediatricians are always like, well, just give them a little Zofran. I'm like, not all of us can write prescriptions for our children and like have it at the ready. Like you're all like,
Vanessa, it's like the one benefit of the job. It's like, we don't get courtside seats at basketball games, but we do.
But you get Zofran. Yeah.
But that being said, will you talk about the dehydration for a second? Because this is really important. What happens when someone's in flight?
Yeah. So in terms of preventing dehydration, I always recommend just taking a little bit all the time. So taking sips, or if some advice would be just to swallow on ice chips, to take a little bit of fluid, like set a timer every 5 minutes, see if you can take a little bit of fluid, and that will help prevent dehydration. Usually if someone's been throwing up for less than 24 hours, they're not in danger of being dehydrated. But that would be my advice, just to try to take a little bit at a time. And the goal is, are you still urinating? You should still be wanting to go use the restroom at least every 8 to 12 hours, or I'd be concerned.
And just to add that, when we're in planes, we get dry. I mean, it's a drying environment, right? Your eyes get dry. I don't know. When I was a teenager, I distinctly remember getting onto a flight and I felt like I had some pimples that were about to come out. And by the end of the flight, they were like, no way, man, I'm not coming out. And my skin was like, right? It's bananas the way that works on a plane. So it is a very drying environment.
It is true. I'm thinking I had a toddler once who threw up on the plane and we just walked off with a naked child. And I got a lot of looks, I'm sure, but you do what you got to do.
I used to pack 3 changes of clothes for each of my children on a plane. Well, we were doing transatlantic flights. I would bring an entire bag of of snacks and stuff like that, and 3 changes of clothes. And the very first time I did not travel with at least 1 change of clothes for each of my kids, one of my kids threw up all over himself.
Oh my goodness. What we do as parents.
I know. It's amazing. Jessica, you are so wonderful. Thank you for your calm, reassuring approach to all of this. I love your Instagram account. You're like so chill and even. And it's like with all the hysteria in the world, you're just like, you calm it all down. I so appreciate it. We'll put links to your Instagram and your podcast and all of that in the show notes. And I hope you will come back and visit it. We didn't even get to talk about mono. I mean, come on. We have so much more.
Thank you so much for having me. I really appreciate it. It was really fun to hang out with you guys. So thank you so much for having me.
Oh, thanks, Jess.
And thank you for what you guys do. I have heard so many compliments about the Puberty Podcast. So many people gain so much insight and feel so much relief after learning from you guys. So thank you for the difference that you're making.
Thank you. Well, apparently I'm also not doing such a great job in other ways, but at least my podcast is helpful, even if my children are in less than ideal situations. Thank you, Jessica. Thank you so much for listening. You can email us with questions, feedback, or episode requests at podcast@lessawkward.com.
If you want to learn more about what we do to make this whole stage of life less awkward for everyone involved, Our parent membership, our school health ed curriculum, our keynote talks, and more are all at lessawkward.com.
And if you want products that make puberty so much more comfortable, visit myumla.com.